Welcome to On the Beat. Today we are joined by doctors from Gastroenterology Associates of Columbus and Starkville. Joining me today, Dr. Ricky Johnston and also William Gillespie. So thank you both for being here. The subject we want to ask you about is GERD, and we hear that all the time. Is it the same as heartburn?
It can be. Heartburn is one of the, manifestations of GERD. GERD means gastroesophageal reflux disease. So that encompasses a number of things that we see. But generally speaking, most people say heartburn, reflux, GERD. They kind of mean the same thing.
Well, that was a question I had before we started, is I don't experience heartburn, but I still have GERD. And so that may not be one of the symptoms of it.
Yeah, you can have regurgitation of things without the burning, and some people have what we call silent reflux, where they don't really have a lot of symptoms. So you don't necessarily have the burning, but most people do.
Okay, and other symptoms somebody could experience if they have GERD?
There's a lot of them, and I tell people GERD comes in different flavors. So anything from like throat clearing, kind of like a lump in the throat, or the sensation like something's there and they can't get rid of it, just, that sensation. Asthma, allergy, trouble swallowing, bloating, pain in your upper abdomen, either in the left, the right, or the middle. So it can kind of present a lot of different ways. And some people complain of like chest pain or tightness. And so sometimes you kind of hear about people who think they were having heartburn symptoms, but actually they may have been experiencing heart problems. And so that's why it's really important to make sure you've discussed this with your physician before you say, yes, it's just GERD.
And how do you treat reflux and GERD?
The primary way we treat is with acid-reducing medications.
Okay.
So there's the proton pump inhibitors that most people have heard of, Prilosec, Nexium, Protonix, Prevacid, things like that. Those are the stronger acid reducers. Then you have things over the counter like Pepcid and Tums, Rolaids that are, Rolaids and Tums are more acid neutralizers. Pepcid can also reduce acid production.
And one thing that we have heard something is about safety of the pump inhibitors. So
Yeah, they're generally pretty safe.
Okay.
There were a lot of reports about all sorts of different side effects. There are a few side effects that we know are real, such as they can increase your risk of a stomach infection if you're taking them with antibiotics. There's some risk in people that have chronic kidney disease. There were some concerns about dementia, but other studies have shown there's no real link there.
Okay.
And a lot of these other side effects they're looking at, but in general, they're pretty safe medicines. We try to keep people on the lowest effective dose that controls their symptoms, and eventually try to get people off, if they're feeling better. But a lot of times the symptoms of uncontrolled heartburn and reflux and the damage that can do may be worse than any of the side effects of the medicine. So.
Yes, it's so complicated in the treatment. So if somebody is leaving this untreated, what could be?
So the biggest thing that we run into as a potential complication is Barrett's esophagus, which is some damage that can occur to the lower part of the esophagus that can lead to cancer, esophageal cancer, if it's not caught and treated early on. That's very uncommon. And there's a lot of people out there with Barrett's, but even if you have Barrett's, the risk is still very, very, very low that it'll ever become a problem.
Okay, so best if you're experiencing any symptoms, make an appointment.
Correct.
Rule out what else it could be.
Correct.
But there are a lot of great medications. Did I summarize that well?
Yes.
Well, thank you both for being here. And if you have questions about GERD or any other issues with gastroenterology, contact the doctors at Gastroenterology Associates, Columbus and Starkville. The number is at the bottom of your screen. That's today's On the Beat.